Okay. Good morning, everyone, and welcome to today's program, Adapting to COVID Operations. I'm Caitlin. I'm the Programs Coordinator at Urban Green. I'll be providing some technical support for today's episode. If you experience any audio or video issues during this program, you can send me a message via the chat box, which should be visible at the bottom of your screen. You can submit questions via the questions box, which I'll be monitoring throughout today's discussion, and we'll try to get through as many questions as possible during the second half of today's program. And then before I turn it over to our moderator and panelists, I want to mention that this event is part 2 of a 3-part series delivered by the Cross Learning Alliance. The Cross Learning Alliance is a partnership between the New York chapter of ASHRAE, AIA New York, and Urban Green Council. The Cross Learning Alliance events are designed to bridge knowledge gap between the people that own, design, manage, and operate and commission buildings. Our first event in this Adapting to COVID series focused on construction. Today we'll be discussing building operations, and then this November we'll discuss design, which I'll share more details about at the end of today's program. And with that, I'm going to turn it over to Tony, the New York ASHRAE chapter president, to get us started today.
Hi, my name is Tony, and I'm the general manager for Federal Pump and Alien Pump. And as Caitlin pointed out, I am also the New York City chapter president of this ASHRAE year. Jonathan?
Hi, good morning. My name is Jonathan Cogswell. I'm the Assistant Vice President of Facilities, Services, and Engineering for Northwell Health's Manhattan region, focused at Lenox Hill Hospital and the facilities are across Manhattan.
Emily?
Good morning. My name is Emily Gove. I work for Building Maintenance Service, a wholly owned subsidiary of Vornado Realty Trust, and I am the Corporate Director of Sustainability and Training.
And last but not least, John.
Good morning, everybody. My name is John Gilbert. I'm Chief Operating Officer and Executive Vice President for the Rudin family.
So thank you again, panelists, for joining us today. I'm going to get right into some of the questions we have. So since the start of COVID, what are some strategies that you guys have come across that worked, or some that didn't work? And given what you know today, what would you do differently in your building's operation? Things like, limiting exposures, ventilation to controls, seeing that buildings are drastically underutilized, cleaning and disinfecting, and especially mental health and mental wellness for your staff. Emily, let's start with you.
Sure. So I think since the start of COVID, we've learned a lot about disinfectants. It was something that we're Green Seal certified as a company, and so we weren't too far off from our existing practices in terms of, wellness and disinfection. But I had learned a lot about disinfectants and active ingredients and what is considered a safer active ingredient, like hydrogen peroxide or thymol, compared to something like quaternary ammonium, which is an asthmagen and not as good for health of our occupants. So we did a lot of deep diving into what we were currently using. We procured a new hydrogen peroxide-based disinfectant that has a shorter dwell time. So things like, the dwell time of a disinfectant, how long does it need to sit on a surface in order to actually be effective? So we had some that were 10 minutes. And when you're disinfecting a surface around the clock in the lobby area, 10 minutes is too long. So, we switched to things that had 1 minute dwell times. We also learned that we definitely need to have a, continuous stock of PPE. We faced a lot of PPE shortages, as we all know in New York City and all over the country. Everybody was having a really hard time getting their hands on N95 masks, on gloves, and I think that one of the biggest lessons learned was to maintain an inventory that we will never, have to experience a shortage again, because then everybody is scrambling to get their hands on whatever they can, and you may end up with, a glove that is, not the same quality that we're used to. And when you're, using disinfectants and cleaning around the clock, it's, you have to have PPE that's going to work and that's going to keep your staff safe. And then the last thing I'll say is just lots of training. The first thing that we did was make sure that our disinfectants were on EPA's list N of approved disinfectants for use against COVID. That was kind of like the very first thing that everybody was doing was, is this on EPA's list N? And then right after that was, okay, getting everybody PPE and making sure that everybody knows how to use it, using CDC videos to train everybody. And we were facing challenges by having to do all of this remote. We weren't in the buildings doing training face-to-face in large groups like we always had been with our OSHA training. So it was making sure everybody was getting the proper training through, a completely new system.
In terms of limiting exposures and these clean disinfectants, you guys had to start implementing schedules or like rotation to staff,
Yeah, we definitely had to stagger our shifts. We set max occupancies for some of the smaller spaces that janitorial teams navigate, like the janitorial closets in some of the buildings, they're tiny. So we had to set, social distancing rules. We put signage up that we created. We put circles on the ground 6 feet apart leading up to things like the time clock so that people wouldn't crowd. And, just making sure that, people weren't, congregating in certain areas in order to, make sure everybody was distanced and safe.
Cool. Thank you. John, same question. Any strategies that really work for you or any strategies that we have implemented that you found wasn't really that effective in your building's operation?
Well, I think the first thing is actually to have a strategy. I think when this thing hit, we started meeting internally with our department managers in February of this year. We obviously were watching what was going on in Wuhan and in China, but then when we heard, that the Dolomites in Italy had an outbreak, it was really clear that this was on its way towards us. And our strategy was fairly simple. It was three-pronged. Number one, protect our employees and our customers. Secondly, to lead through communication. I think what Emily just talked about, the ability to communicate in a COVID world is totally different than the ability to communicate in a non-COVID world. So embracing those digital communication strategies was hugely important in order to get the word out of what you're doing. And then the final, leg of our strategy was leverage the data that you're already collecting. Use the data that you currently have, whether it's occupancy data, whether it's indoor air quality data, whether it's temperature, humidity, whether it's lobby condition data in terms of, obviously the first step that we had to take was really look at each of our lobbies differently. They were no longer a pass-through. They were no longer simply a place where people are going to walk in the front door and go directly to an elevator. We had to come up with routing in terms of foot traffic. We had to come up with, obviously, the social distancing, where the stanchions were going to be, where was the thermal scanning going to be if we were utilizing thermal scanning. Ultimately, what was an entrance, what was an exit. So we created a digital platform for each of our buildings based upon what we felt was the right thing to do. And then as soon as we could, and as soon as it was ready, got it out to our customers so that they knew when they showed up at that building and that they could share with their employees that it was going to look different, it was going to feel different, and ultimately you needed to know this information so you knew what to do. I think the communication piece, I can't stress enough how important that piece is. We actually created an app that allows people to go to our buildings, get into the building from a touchless standpoint, use your phone with a QR code that ultimately gets you through the turnstile and gets you up into the elevator. You can get off the subway and you can immediately know, is there high traffic in the lobby right now? Are there elevator wait times? You immediately can find out what, in terms of basic indoor air quality data, temperature, humidity, and ultimately CO2. And ultimately, we're now able to communicate directly with every single person who's works in our buildings to give them up-to-date information if necessary. So, I think the leveraging of the data, as many of you know, we have an operating system called Nantum, which utilizes real-time machine learning and artificial intelligence algorithms. So we're able to extract that data, how many people are in the building, how many people are in the lobby, and ultimately share that to make it very personal to the person who's actually walking into the building. Signage is a huge thing. The amount of time that we've spent in terms of designing signage, as Emily talked about, the circles on the floor, you can stand here, don't stand here, that type of stuff, signs outside the building, no mask, no entry, all of that was hugely important. And then add in all of the issues in terms of cleaning, changing all of our filters, upgrading the filters where necessary from MERV 13 to MERV 15. All of that was kind of, table stakes to what had to be done before June 22nd, when the governor said it was okay for people to come back.
Cool. Thank you. Yeah, so communication definitely is key. I found that to be true for my organization as well. And Jonathan, so we heard about disinfecting, cleaning, signage, communication. So again, same question to you. Strategies that work for you, and some that might not have been as effective, and what would you do to your building's operation today?
I think, from our perspective, it was consistently developing our strategies. Because unfortunately we had to learn on the fly as we never closed, and so it was, our drive was always, how do we keep our staff as safe as possible throughout the entire thing. And I think what Emily mentioned before about PPE was always a big challenge, and I'll find it interesting to see how on the commercial side, if there's a change in thinking about preparedness and stock of materials. We always have a drive to maintain 30 days of supply of our primary materials in the healthcare world, and you don't necessarily think of those things on the commercial side. And it'll be intriguing to see if there's if you see organizations start keeping a larger stock just of preparedness supplies that they may not have thought of in the long run. But I think, from our ambulatory side of things, which was the side that did close down and has started a staged rollout, I think there's kind of two sides to the safety world in that. I think there's the side of constant communication and education about personal responsibility versus what the facility needs to provide for the employees and the environment in which the employees are working. I think a constant reminder and education about wearing masks and limiting exposure to large groups, and just a constant reminder that everyone is a part of the reaction to this, that it's not just the responsibility of the organization to keep the staff safe, it's everyone's responsibility. And that, and constantly reminding people. It's hard when we live in a very social world, and there's, there are constantly events happening, birthday parties, the holidays we just passed, the holidays that are coming up, and it's hard to say no. But I think it's just a constant communication, as John was talking about, that, it's important that we do this for each other. And then I think there are things that can be put in place you know, we have been putting in place, and I'm sure everyone's been putting in place, the barriers, you know, providing PPE, providing the hand sanitation stations, things like that, you know, there are critical to helping these people focus on their safety and keeping their coworkers safe. You know, I think from an air quality perspective, it's looking at your air handling systems and looking at your filtration levels, and, you know, do we bump up to a MERV 14? Do we bump up to a MERV 16? Depending on what's going on. You know, we've set standards for our clinical facilities where, you know, our inpatient facilities are now operating on a minimum of a MERV 16, and our outpatient facilities, where we can, based on the air handling system, are operating on a MERV 14, so that we can just enhance that filtration a little bit. But you know, as both Emily and John have said, it all comes down to communication. It comes down to constant sanitizing of the facility, and it comes down to shifting your staff so that you can operate in a socially distant environment.
Cool, thank you. And that actually, preparedness, actually, it's a good segue into what I'm going to ask next. And I'm sure this is on the minds of many people, you know, with the combination of the cooling weather approaching flu season and number of businesses trying to summon their employees back to the city, into our buildings, you know, how should we prepare for this? And it's a question for everybody.
Yeah, I mean, I think I'll jump in. You know, obviously, you know, Jonathan said it right. There's a huge amount of personal responsibility here that people have to take. You know, our employees, Rudin management employees, they've got to fill out a questionnaire every day before they come to the office, take their temperature, identify, have they come in contact with anybody who has been sick or is showing symptoms. You know, obviously these are seemingly small steps, but they're really, really important steps. You know, the mask wearing. I think, you know, it's crazy that, you know, the United States of America, I think, is the only country that I've seen, and maybe we're not seeing coverage, that has managed to politicize the wearing of a mask. You know, put the damn mask on. I mean, and be done with it. And don't even debate this. This is not a debate. Just wear the mask. You know, it's anywhere from 50%, you know, effectiveness in terms of groups that come together, whether you're, you know, there's a 50% greater chance of getting sick if you don't wear a mask than if you do wear a mask or not. I mean, the numbers are very compelling. You know, I think what we really need to do is to look around the corner. You know, I think obviously the rapid testing, you know, where our occupancy numbers are right after, you know, June 22nd, we were in the single digits. Right now, I think the highest we've hit is 17%, something like that. So we're running into the mid to high teens. You know, there are thousands of people who are not coming back to work yet, just in our portfolio. So, you know, it's our job ultimately to do all the things that we've all been talking about, but then let people know what we've actually done. I think when people do walk into our buildings, we're getting a lot of positive feedback. Oh my goodness, you've thought about everything. And so, you know, you really have to kind of step back and look at, you know, who is my customer? What is my customer expecting? What am I expecting as a human being in terms of livability and understanding of what the new protocols have to be that we've now, every one of us have redone our protocols. You know, so explain that. And you can't do it enough. Our whole focus is, I'm going to do it until you tell me not to do it anymore. Because the more I come back at you, the more I show you, the more that there is an effort here, a true strategy that has been implemented, the better you're going to feel about coming to work, and the better that, you know, we're going to feel about you coming to work. So, you know, we've started Samantha Rudin started this concept of work from work. And I think, you know, once people come back into the office, and Rudin management, we've been averaging, you know, about 40% on a daily basis, and we've staggered people so that we're not over the 50% threshold. But we're seeing people want to be back at work. They're happy to be back at work, and ultimately feel safe.
Yeah, you know, John, I think you made a good point with, you know, with the app that you guys are using for your staff. You know, we do the same thing where, you know, we have just a simple 10-question questionnaire that everyone is required to fill out every morning before they come to the office. And, you know, and it immediately drives you if you answer anything, you know, no, or if you answer anything yes, actually, I'm saying, you know, it immediately directs you to our employee health, and you need to talk to them before you can come to the office. It gives you, you know, big red bar, you're not approved. And I think that that's helpful in multiple ways. And I think it's also helpful as just an ongoing reminder to people that, remember, this is still something. And this is, you know, don't forget what you got to do on a daily basis. And, you know, I'm 150% right behind you, John. Just wear the damn mask. It's not that hard. We're not asking you to go, you know, to do something that's that difficult. And, you know, and it's frustrating when you see that and you get people that argue with you. And, you know, but it's, you know, it's difficult to respond and not argue. You know, we have those debates sometimes. You know, we didn't allow visitors in our building for a long time, and it took us a while to figure out how to safely start allowing visitors back into the hospital. And, you know, and it's a multi-step program, and, you know, with the thermal scanners and the questionnaires but now we're also putting our staff to a point where they're going and they're meeting with each of the visitors and taking them through the questionnaire before so now we also have to be concerned about keeping that staff safe, and because we don't know what they're interacting with, and then some visitors that you get those arguments from, and how do you, from an empathetic perspective, how do you respond to them and convince them that, you know, listen, you need to put your mask on. This is a mandate. This is a requirement, and not turn it into a battle. And, you know, and trying to find that balance, it can be very challenging.
I absolutely agree with everything that you guys say. Wear the mask, pay attention to the New York State quarantine, like travel advisories. That changes daily. I know that, you know, just yesterday, 3 more states were added. They were taken off. I know it's going to be really difficult as the holidays approach and people want to travel. And I think I'm tired. I think everybody has COVID fatigue, but we can't let our guard down because they're going into, you know, colder temperatures, as you said, Tony, and, you know, the flu. Get your flu shot. I've already gotten mine, made my husband get his. You know, the flu sends people to the hospital every year. And so if we can cut down on that and make room for, you know, COVID patients, I think that's really important. And yeah, wear the mask. It's a collective responsibility for everybody to do the right thing. And, you know, if we have a zero tolerance, so if somebody comes into our building and their mask broke on the way or they don't have one, you know, we have that to provide to as needed.
So still communication and preparedness. That's what I got from this. So so let's fast forward, hopefully, you know, in the near future, where we no longer have to worry about the threat of COVID. Are there any practices that you guys have learned that you think you're going to continue?
I think, you know, I think that we'll probably just continue doing what we're doing. Disinfection of high touch surfaces several times a day. You know, like I said, with the hydrogen peroxide and the safer active ingredient for disinfectants, and Green Seal put out safer disinfection guidelines. I think we've adopted that, and we have kind of, I have a green clean policy for the company, and I have embedded this stuff into that policy as a permanent piece. So I don't think that we will go back to any less disinfection or using any quaternary ammonium-based disinfectants. I think that what we've learned for the most part will stick with us, whether COVID's around or not, because, I hope it's a very long time before we have another pandemic, and I hope that COVID isn't something that kind of resurfaces seasonally like the flu. But I don't think that now that we've gone through all of this work and suffering, quite frankly, that we want to let our guard down anytime soon.
Yeah, I'm in total agreement with you, Emily. And I think, as we've gone through this, of course, it's been the focus of everything. It's been COVID, because that's what's happening right now. But I think, what is key is that, we've experienced this, and we're still to a point going through it. But when this trails off, it can't be forgotten, because whether it's COVID-20 or it's something else, something else is going to come down the road eventually. And we need to not go back to where we were. We've learned, we've adapted, we've enhanced, we've improved, and we need to maintain that new level of vigilance to keep everyone as safe as possible. Because when you think about it, this is helping with the flu. With the spread of the flu, we're being cleaner, we're being safer, we're being, and this can help with the spread of things that we're used to, and help improve, or improve people's chances against those other diseases. And I think it's just, it's that constant vigilance that I think will hopefully continue as we move into the future.
Yeah, we had a really interesting Zoom call, probably back in May or June, with real estate executives from the Far East, Beijing, Singapore, Hong Kong, and one other that I'm forgetting. But the guy from Beijing was really interesting when he said, and he said it in somewhat of a condescending way, which got my attention, which was, hey, we in Beijing have had 4 major outbreaks in the last 19 years. So all of you in America, A, are a bunch of wimps, and B, aren't paying attention as to what we've actually gone through and the protocols that we now have. I was always amazed when you saw the streets of Beijing or Shanghai. That was the other city, was Shanghai. People are wearing masks. Whether there's an outbreak or not, people are wearing masks. So I think, sadly, the world looking forward is going to be a world that we're either going to be in the midst of an outbreak or doing whatever we can to prevent an outbreak from happening. And if you look at Beijing's experience, literally every 4 years, they had an outbreak. Okay, well, that's kind of, like our presidential elections every 4 years, they come very fast. So I agree with Jonathan, is that we're going to continue, and Emily, we're going to continue doing a lot of the things that we're now doing. I think thermal scanning will probably go away. But I think what we all have to do is think about our lobbies. How much bandwidth are we pumping into our lobbies now that we're actually going to be queued up and limiting the number of people that can get into an individual elevator. And there's a very interesting, new development. It happened in January of this year, so a lot of people didn't, follow it because COVID came. But the Federal Communications Commission has deregulated 150 megahertz of wireless spectrum and given it to property owners. It's called the Citizens Broadband Radio Spectrum. That's a huge amount of wireless spectrum. We get it for free. They did it so that they can accelerate the deployment of 5G technologies. So we get faster speeds. I don't know if you saw with Apple's announcement of their new phone, there's actually a CBRS chip in that phone. So 5G, is upon us. And I predict that 5G will come to buildings before it will come to the larger community because of the CBRS deregulation of that spectrum. So I think that's something we have to think about. I think all of us, and I know this is close to Jonathan's world, in terms of rapid testing. Emily talked about travel restrictions and travel protocols. Well, all of the companies that work in our buildings and that take space in our buildings, they're going to start traveling. They already are. And so what we've done is we've established a rapid testing center at 345 Park Avenue for our tenants and for our employees. Anybody who does travel, rather than quarantine for 14 days, like Emily talked about, they can come in, get the rapid test, and then immediately know whether they've been exposed, and then whether they retest. That's going to depend upon the company's protocols in terms of travel restrictions. So we've got to do that. For us, it's refining, the app, making sure that we can leverage as much of the existing data as we possibly can, and leverage new sources of data that people will want to know and deserve to know what's going on in the building before they walk into it.
Thank you. So we're basically saying this is the new normalcy. And I mean, obviously that's being redefined on nowadays seemingly every month, but that's an interesting perspective. So John, you had mentioned, you guys are hitting the upper teens now in utilization of your buildings. Putting on my sustainability hat for a second, I'm curious for the buildings that are underutilized today. What are we doing, and if there's any strategies against limiting, some of the vampiric loads from the customers who are in the buildings, who are not in the buildings, and they still have, machines that are still plugged in. Thoughts?
Yeah, I mean, to me, that was the biggest surprise that I had through this whole process was when our team came in and said, our occupancy has gone to single digits, but our electrical demand has only dropped 30%. And I said, not possible. Go back and redo your math. Those numbers have to be wrong. And what we discovered was that in order to have a work from home strategy, there's a lot of equipment that has to remain turned on and accessible within the office space. All your servers, all your routers, all computers, in effect, they stay on. So the only thing that's changed is plug load, or actually HVAC load, that's required to meet the demands of that occupancy of each of us as a 100-watt light bulb, bringing heat into the building. So that was a huge surprise to me. I really expected that number to be closer to 60%, not 30%. But that's something that all of us have to realize, that in order to work from home, it's not just, okay, we go from 100 to 0 at the office. We're going from 100 to 70. And so there's still a significant amount of energy that's being consumed and carbon created through the consumption of that electricity, even with a work from home strategy. It was very, very interesting to me and very eye-opening.
I'm also intrigued to see what happens over the next 6 months in the technology world. You see how technology reacts to major events, and I mean, we've been watching it in the healthcare world, because invariably in the healthcare world we're behind from a technology perspective, and just watching how quickly things are changing and how quickly the technology vendors are adapting to what is becoming the new norm, and how many organizations are going to start switching to more cloud-based and get off their dependency on the desktop and more to server farms versus the servers they maintain in their offices. And I think from an energy perspective, I think one of the good things with going to server farms is a lot of those large-scale data centers work on alternative energies and and are more self-sufficient, and hopefully we'll start seeing that adjustment from these office-based networks to more cloud-based networks that that allow us to change from ground-based the energies of the utilities to more alternative sources of energy to help reduce that footprint.
Yeah, that will be interesting.
Thank you. And I think these figures that you guys are sharing absolutely it's interesting to see. 30% reduction in where technology is going to take us. And as you guys have learned and now becoming affluent with these protections and operation, where do you guys look for expert guidance yourself? I have heard CDC for some national guidance. Where else and who else do you guys turn to? And what do you guys ask for? And what kind of advice do you guys get?
We obviously we've got an enormous amount of domain expertise, and I'm very active in several real estate groups, the Real Estate Board of New York, Real Estate Owners Council, Realcomm, nationally. So we're obviously comparing notes. We may be competing for a tenant or a piece of dirt on one side of the business, but on this side of the business, there's been a huge amount of sharing of information and technology. We're all asking and having to answer the same questions. So why don't we compare notes, and why don't we share strategies? Because at the end of the day, this is about New York City and about the United States of America. It's not about an individual building on 52nd Street. We've got to solve this together, and we've got to come up with a strategy that's cogent, that's articulated, and that ultimately is digital, so that it can be accessed. And we've all got to do that together, or shame on us.
Yeah, I'm such 100% agreement with you, John. I think one of the greatest things that has come out of this is collaboration. And, I think, in the healthcare world, we talk nonstop across the country. And, we in New York were obviously hit early on. And the time, whatever I had 5 minutes to rub together, I was on the phone or on a Zoom call with someone in California or someone in Texas or a group of people in the Midwest talking about what we were doing to react, what we had learned in the last 24, 48, 72 hours, so that they could start preparing, so that they could learn from us, learn from our mistakes, as we learned on an hourly basis of what we had to do, and they were able to start preparing themselves. And I think it's still going, and that collaboration is still going. And even down to collaboration between architects, engineers, contractors throughout this entire event, and the fact that everyone just came in, got around a table, and hammered out solutions. There was no battle about, well, the engineer said this, but the architect said that, but the contractor's right. It was, let's get around the table. We got an hour. We're going to figure it out, and let's get it under construction. And it was as horrible of it as a group of events it was to go through. It was remarkable to see what putting all these heads around the table with absolutely no one trying to be right or the best or this, just everyone with a common goal and going for it. It was tremendous, and it's my deep desire that this continues, and that we continue as a field to work together and to just continue finding ways to improve as a group, not necessarily as a singular organization.
I completely agree. I have wonderful coworkers in Chicago and Washington, D.C., and we were constantly comparing notes on emerging technology and what kind of supply chain issues are you having? Are you able to get this product, or things like that, and sharing our notes and like it was said, sharing our lessons learned in New York, because we were kind of hardest hit at the beginning. In terms of like agencies and organizations, I already mentioned like the EPA List N. That's where you can go and search for any disinfectant using their EPA registration number and make sure that it's on that list as approved to kill COVID. That list has grown tremendously since March. CDC was super helpful with the reopening guidelines, cleaning guidelines. New York State and New York City Department of Health just giving local guidance, such as like how to dispose of used PPE, and also OSHA offering PPE guidelines, which we've always, been closely monitoring, but things like respirators and fit testing and things like that. And then one that I hadn't previously really been monitoring, but it came across my desk was the American Industrial Hygiene Association. They also came out with workplace cleaning guidelines. So it was just a matter of like comparing all of the different guidance and funneling it into one kind of like reopening plan, and then just continuing to modify and build upon that plan as guidance kind of evolved and changed. And we've learned a lot about COVID since March. We've learned that like surface transmission isn't as likely as like human to human. So kind of just like monitoring a bunch of different areas and sorting through it and talking it out with your coworkers and your peers move forward.
Thank you. So this ends my line of questions for the panelists. We're going to go on to the Q&A from our audience. The first question I have here is for Jonathan. You had mentioned having a 30-day supply of PPE and a number of things. In real life, Neil's asking, how long did it actually last? Was it actually 30 days or?
Well, I think, early on it was, it didn't make 30 days, but I think once we learned what the new usage patterns were, we were able to, to increase our volume to be able to have 30 days on hand, and it fluctuated. I think right now our goal, and I think we're pretty close to hitting it, is having 90 days on hand. We're lucky that we're a very large health system, and we have, central stores in a couple of different locations, and we have the room to stock it. So, but we're, we've been nonstop just purchasing PPE between face shields and masks and gowns and gloves. And I believe I heard on the call Monday that we had achieved our 90-day stock.
90 days. This question comes from Ellen. How quickly can you guys react to the changes in the volume of people using the buildings? That's a question for the panel.
For our buildings, we can react immediately. The data that we're collecting is generated on a 10 to 15 minute cycle. So when we have a spike in occupancy, all of our air handlers respond immediately. That's all automated. And the data that's flowing to our customers through our app is all in real time as well. So that happens immediately. And I've got to say that, the more we learn about just running buildings in general, COVID, no COVID, monitoring occupancy data probably is the most important aspect of running a building in the 21st century. Because to be able to overlay that occupancy data, whether it's on water consumption, whether it's on electrical consumption, whether it's on airflow, whether it's on chilled water temps, it all impacts that. And it's a huge opportunity in the middle of the day, especially when people go to lunch, to take that big divot of electric demand out of your curve as simply by coordinating fan speed with occupancy data. So it's huge. It allows us to start our chillers later in the morning, as late as we possibly can through our machine learning algorithms, and then ramp down quickly at the end of the day. So net, you can save an enormous amount of energy simply by monitoring occupancy and then pointing that level of comfort to the number of people in the building.
Sure, data definitely drives a lot, many aspects of our lives today, and you guys have done that using the application. And we have another question regarding the application. Is there any implementation of contact tracing on the applications currently?
We're working on that. Generally we're leaving the contact tracing to the public health folks, but there is an opportunity to do that within our app. Once we jump into that, we're into and this is something Jonathan will appreciate, dealing with health data itself and individual health data that puts us into a whole new arena. So we're happy to leave it to the folks who are actually in the business to contact trace, and turning over that data to them, and obviously protecting individuals' identities and their own individual health issues.
Thank you. And I think this is a question that should be directed at Emily. Scott asked, when you're discussing hydrogen peroxide, are you referring to using it as a liquid for cleaning or using it as a dry spray for cleaning technique?
So when I'm referring to hydrogen peroxide, I'm referring to that as the active ingredient for the disinfectant. And we're using that in liquid, like ready to use spray. So if you look on the SDS of a disinfectant, or if you use EPA's List N, you type in the registration number from EPA, it will give you the active ingredient and then the percentage of it. And so that's what I'm referring to, is a ready to use spray that is hydrogen peroxide based. And that is better than like a quaternary ammonium, which is very, very common actually. There's all different types of chemical makeups of the quats, but basically Brain Seal came out with safer disinfection guidelines, and things like hydrogen peroxide, plant-based active ingredients like thymol, things like that are considered safer for occupant health. So we have kind of pivoted away from quats and gone with the safer stuff.
Thank you. Thanks for clarifying. Next question goes to Jonathan. For outpatient facilities, did you make any changes to the HVAC units to increase the outside air intake, the TBA, redirect supply, exhaust air for better airflow and pressurization?
We did not do that in a significant number of our facilities. Really, we looked at, what type of ambulatory facilities they are, and what actually is happening in those facilities, to make the determination as to how we reacted from an HVAC perspective in those locations. If we had facilities that that had some semblance of procedures happening in them, we then looked at the air handlers to see if there was any way to adjust, to increase to a little bit more outside air, to balance that out, and as I mentioned before, upgraded filtration. We try to balance the way we utilize the HVAC with the way we utilize our energy, obviously, and it's so we obviously say patient safety and staff safety comes first, but we made the decision we didn't want to go overboard, that we wanted to stick to what we felt we had learned along the way as we were getting ready to reopen these facilities, and just a regular primary care physician office. We didn't feel it was as necessary as some of the more procedural type areas.
And you had spoken about upgrading filters earlier as well, and I think this question would be directed at you as well. So in terms of the filter changes, I guess it applies to all buildings. This gentleman is asking, is there any concern with the actual filter changes? And he's referring to the folks who are actually doing the filter changes. do less restrictive filters need to be handled like HEPA filters?
I mean, we made that determination early on, that, you know, I have my engineering staff that are doing the filtration changes along the way, wearing appropriate PPE, just out of an abundance of caution. You know, there's no real hard proof at this point. You know, you hear different things about how long this lives on surfaces and different types of surfaces, and some people say 10 hours, some people say 45 minutes, and it just, you know, it's been a moving target throughout this whole thing. And we made the decision early on that, listen, guys, when you go to change filters, you're just going to wear full PPE. You're going to wear your mask, you're going to wear your face shield, you're going to wear gloves, and you're going to wear a gown, and you're going to pull it, you're going to immediately double bag it, and you know, and it's just, it was the smartest thing to do to be ultimately safe.
Right. Safety's first. And I have one last question, and it's for the panel. Somebody asked that they've heard of some buildings testing wastewater to identify COVID outbreaks. Is this a method that you guys are potentially exploring?
We haven't gone there yet. To me, that's something for the Department of Environmental Protection in the city of New York to do. I know there are communities that are doing that, but to me, that's more of a public health decision rather than an individual building decision.
Agreed. Yeah, we're also not doing that.
Yeah, and it completely in agreement with John. It's not something that's being mandated for us to do.
Got it. And that's all the questions I have. Any other final comments you guys have? Well, thank you.
My final comment is don't bet against New York. We're going to get through this. We're going to be stronger as a result of it. And, lessons learned, don't let ego get in the way. And as Jonathan and Emily have said, the collaboration with your perceived competitors is hugely important. This is something that we've got to do together, and we can't do it alone. So working together is very key and crucial.
Yeah, just communicating with compassion, communicating vigilance, and as John said, communicating our impending success.
Alrighty. Caitlin?
Great, thank you, everybody. And thanks to everyone who's able to join us today. I'm just going to go through a couple upcoming events that we have. Let me just share my screen here. Should all be able to see that. Here we go. In terms of some upcoming events, we have on October 22nd, Busting Myths about Next Generation Refrigerants. During this webinar, you'll hear from panel experts from leading HVAC manufacturers discuss the timeline and regulatory changes we should expect to see in next generation refrigerants. From November 9th to the 17th, AIA is hosting Retrofit Now, Reducing Carbon and Complying with Local Law 97. This course content focuses on preparing attendees to maximize the reductions achieved in both types of interventions and provide a framework for advising building owners and managers that can create long-term relationships and drive deeper reductions. Then on November 10th, we have the third part of this three-part series, Adapting to COVID Design, where design teams will share what new safety features they're using and what they envision using on future projects. And then on November 13th, we have GPro Fundamentals of Building Green. In this online course, you'll learn to see how learn how to see buildings differently and discover strategies to make them efficient, healthy, and resilient. G-Pro Fundamentals is designed for a range of real estate, construction, architecture, and engineering professionals. And this course is ideal for anyone who needs a better understanding of high performance building. And then finally, I just want to highlight our Urban Green Council's Energy Code courses. What's new in the 2020 New York City Energy Code. You'll learn about 2020's new provisions in this 90-minute course available to the public or your organization, free of charge. And then we also have Crushing the Code, which is a full day course for 7 CEUs and a deep dive into the Energy Code, learn how it works and the new requirements in the 2020 New York City Energy Code. Commercial courses are available now. You can register for those at urbangreencouncil.org/energy code and for events at urbangreencouncil.org/events. And that is all for me. Thank you all for joining today and have a great day.